Welcome to the Caring Compass. Today we are going to talk about asthma. First, let's see what exactly is asthma. When we inhale the air from outside, air goes through trachea, bronchi and bronchioles. At last, air exchange happens in the alveoli. The airways are the tubes that carry air in and out of your lungs. Asthma is a chronic condition that causes narrowing and inflammation of the airways in your lungs. In people with asthma, these airways are sensitive and can get inflamed and constricted when triggered by certain things like allergens, exercise, or even stress. So your airway is surrounded by smooth muscles and a mucosal layer. When allergens enter your airway, these smooth muscles constrict and narrow the airway. And when allergens enter your airway, your body recognizes it as a foreign body, and as a response, the goblet cells in your mucosal layer increase mucus production, and it causes the lumen of your airway to narrow. When this happens, the airways narrow, making it harder to breathe, which leads to the symptoms you may have heard of like wheezing, shortness of breath, coughing, and tightness in the chest. Now, you might be wondering, what causes asthma? Well, it's a bit of a mix of genetics and environmental factors. If your parents have asthma, you're more likely to develop it too. But asthma can also be triggered by environmental factors like exposure to allergens, air pollution, cold air, or respiratory infections. Some common triggers include pollen, dust mites, pet dander, smoke, and even exercise or cold weather. Everyone with asthma has different triggers, so it's important to pay attention to what makes your symptoms worse. So, how do you know if you have asthma? The most common symptoms include wheezing, a high-pitched whistling sound when you breathe. Shortness of breath, especially after physical activity or at night. Coughing, particularly at night or early in the morning. Chest tightness, like something heavy is sitting on your chest. If you're experiencing any of these, especially if they are happening regularly, it's a good idea to visit your healthcare provider for a proper diagnosis. Asthma cannot be cured, but the good news is that it can be managed effectively with the right medications. There are two main types of asthma medications: rescue medications and controller medications. First, we have rescue medications, also known as quick relief inhalers. These are used for immediate relief during an asthma attack, or when symptoms flare up. They work by relaxing the muscles around your airways, opening them up so you can breathe easier. These are typically used as needed during episodes of wheezing, shortness of breath, or chest tightness. The most common rescue medications include albuterol, Ventolin. This is the most common quick relief inhaler. Levalbuterol, a similar medication that is sometimes used for people who need a gentler version of albuterol. Then, there are controller medications. These are long-term medications taken on a regular schedule, even if you're feeling fine, to help control asthma and prevent symptoms from coming back. They help reduce inflammation in the airways over time and make the airways less sensitive to triggers. Controller medications don't work right away, so they need to be taken consistently as part of your daily routine. Some common controller medications include inhaled corticosteroids, ICS, like fluticasone, Flovent, and budesonide, Pulmicort, which reduce inflammation and prevent airway constriction. Leukotriene modifiers like Montelukast, Singulair, which block chemicals in your body that cause asthma symptoms. Long-acting beta-agonists, LABAs, like salmeterol, Cerevent, which help relax the muscles around the airways. Combination inhalers, which contain both a corticosteroid and a long-acting bronchodilator, such as Advair, fluticasone, salmeterol, and Symbicort, budesonide, formoterol. And if we divide these medications according to their actions, there are only two types of asthma medications. Bronchodilators. They dilate your bronchi and ease your airflow. So let's see examples. Beta agonist. There are short-acting beta agonists like albuterol, and long-acting beta agonist like salmeterol and Symbicort. And these drugs can cause tachycardia. And the next one is anticholinergics like ipratropium and tiotropium. These anticholinergic drugs can cause dry mouth. And there are xanthines like theophylline. And the second type is anti-inflammatory drugs. Corticosteroids are anti-inflammatory drugs. Examples for corticosteroids are fluticasone, budesonide and beclomethasone. And the next example is leukotriene modifiers like montelukast. Leukotriene causes smooth muscle constriction and increases mucus production. Montelukast blocks the function of this leukotriene. So montelukast relaxes smooth muscles and decrease mucus production. For more severe asthma cases, doctors may also prescribe other treatments like biologics, which are injectable medications that target specific parts of the immune system responsible for asthma flare-ups. Medications like omalizumab can help control asthma in people whose symptoms aren't well controlled by inhalers. But managing asthma isn't just about medication, it's also about making lifestyle changes to avoid triggers and stay active. Exercise is actually one of the best things you can do for your lungs, but it's important to take precautions if you have asthma. Make sure to warm up before any physical activity, avoid exercising in cold or dry air, and always have your inhaler with you just in case. Here are a few tips for managing asthma. Know your triggers and try to avoid them. Keep your inhaler or rescue medication nearby at all times. Take your prescribed medications as directed. Create an asthma action plan with your doctor so you know what to do in case of an attack. Monitor your symptoms and peak flow regularly. It can help you catch issues before they get worse. Living with asthma doesn't mean you have to stop living an active and fun life. It just means you have to be mindful of your health and manage it well. With the right treatment, you can breathe easier and do what you love. Remember, if you or someone you know is struggling with asthma, don't hesitate to talk to a healthcare provider to create a treatment plan that works for you. Thank you for watching. Stay healthy, stay informed.